Blog Talk Radio.
Well, how are you doing, folks? I hope you are doing well. And this is Danny Tisdale, and you're on the Danny Tisdale Show. And we're here to talk about coronavirus, COVID-19, and we're calling it the COVID crisis here in Harlem and around the world. And we use the Harlem to Harare in some of our articles, and in a true sense, with the COVID virus, it certainly seems to talk about the fact that we are living in a village where we're all connected to each other. And, you know, I guess as Governor Cuomo said the other day, as we order masks from China, it's ironic that as quote unquote they've said the virus comes from China, here we are ordering masks from China. What's great, though, is that we have Dr. Randi Nelson here with us again. Medicine became her second career, I guess one could say. She's worked 14 years in investment banking before deciding to give back to the community, and she'd earned her accounting degree from State University in Buffalo and an MBA from Hofstra University and an MD degree from Stony Brook in medicine. Her residency of at Jacobi Medical Center at the Einstein College of Medicine in the Bronx. That's where she did her residency. She is a fellow of the American Academy of Pediatrics, and a recent recipient of the Arnold P Gold Foundation Award. Dr. Nelson was born and works in Brooklyn. Dr. Randi, it's great to have you here with us again. How are you doing?
I'm fine. I'm glad to be here. Thank you for inviting me back.
Well, thank you for being back. And we talked a little earlier, and March 17th was the last time you were here on the show to talk about the coronavirus, COVID-19. And wow, so much has gone on since then. But it's great to talk to you. And if our numbers are correct, the virus numbers has almost tripled, quadrupled since the last time we spoke. And I spoke to a number of my friends. Yeah, and I've spoke to a number of my friends, and they have friends who have the virus, or sadly, they've known someone who has passed. How do we
Same here.
Get here? Yes. From if we just start from the 17th to today, what are we not doing right? I guess I should ask. I'm almost speechless.
I know. If I take a look at the numbers on the 17th, there were, and this is New York State, not broken down by the city, but there was 1,300 cases in New York State, 12 deaths. Today we have 113,000 positive cases and 3.5 deaths. And I believe 2.6 of it is attributed, it's in New York City, and the rest is outside of the city. So we're
not even talking about a month.
2.5 weeks. Now, a lot of that is probably due to increased testing, of course. So you test more, you get more positive. I believe that's probably part of it, but the only thing I can think of is that the virus was circulating in our community much sooner or earlier than what we expected. The first case was case in New York was March 1st. So this is just what I feel. This is, I don't know if there's anything scientific or if this is improvement, but I feel like it's been circulating for probably weeks. And, we're in New York City. There's 8 million people in New York City. There's another 3 or so on Long Island, and then many others upstate. And especially in the city, the density of us, we all live on top of each other. We take the mass transit, and I just feel like the virus just has been circulating for much longer.
Yeah.
To explain this, to explain this exponential increase.
And so I know I'm getting ahead here, but I'm just curious. So I will understand this much better once it's over, once we have time to think strategically of how we got here, and I imagine that some of the questions we're asking now will probably be answered. Yeah. I mean, I think we can, like I said, the density of New York, maybe we should have been a little bit more aggressive in the stay-at-home, stay-in-place kind of initiative. But, it's all moving. Hindsight is 20/20. I know, like in California and Washington, they're starting to see a flattening of the curve. The slowing down of new cases. So, and they're two areas that initiated shelter in place very soon, very quickly. So we are seeing that. Even in Italy, they're not seeing as many new cases. There's less ICU admissions or people in the intensive care unit. So, it's just we could see some things, but I think, like you said, once we get over this initial period and we can look back and see what we did wrong, what we did right, we'll have more answers. And so, I jumped to, a reflection quickly, and I want to go back a little bit. Mm-hmm. What have we learned, Dr. Nelson, and what we should be doing now? Well, I mean, in terms that we know works. Well, it's like this. It's really the same thing. It's the social distancing, the same infection control, washing your hands. Now, one of the new things that's popped up is that they want us to wear. The authorities would like for us to wear masks. Right. During our everyday movement. Whenever we go outside. Stay at home whenever we go out, which should be minimal, like only for groceries, medical services, or for medicine. That's it, really. But when we do those things, we should be wearing a mask. That's very new. Because initially it was, oh, no, don't buy mask, leave the mask for the medical professionals, which is still true. Right now they're recommending, like, the homemade mask. And still leave the surgical, like medical grade surgical mask, and especially the N95s to the medical professionals, because we have a huge shortage here in New York. So that's one major change, but it's still the same thing: social distancing, washing your hands properly. Wash your hands. Don't touch your face. Right. Don't touch your face. What else? Disinfect all, the areas of your home that you touch a lot, like the doorknobs, table surfaces. It's the same thing. And now, I think when we last spoke, we were in a pause. I think that's what they call it. Pause. There's all these different terms. Pause, stay at home, shelter in place. But we were in a pause period where, Governor Cuomo asked for everyone, non-essential workers, to work from home. He shut down the schools. But now we have the playgrounds shut down because everyone was congregating in the playgrounds. Long Beach here on Long Island, that's another place they had to shut down because everyone was going there. So, it looks like we're doing things incrementally in steps, almost in a reactive way, not so much a proactive way. Proactive, that's something that's a big takeaway. And but it's really the same. It's really the same things. We just have to adhere to what we already know. Strongly adhere to it. Right. And I know it's like you said earlier that it's easy in hindsight to kind of look at things and say, oh, this should have happened, this shouldn't have happened. And so I this question is one of those, and still may apply, of course. Do you think that those at the top should have and should declare that we have a national, emergency, and no matter how one feels about states' rights, that nationally these are some things that we should do that we've learned that are best practices, or how do you feel about that if you do?
Going forward, yes, I think going forward, if how do I say if this should creep up into our world again, which it may very well so. We have to do something. It looks like we have to be aggressive. We have to do it from a top level, because right now everything is very piecemeal. The states are doing this. One state is doing this. All the states are trying to find their own ventilators. Everyone's trying to get their own PPE. They're all almost working against each other to get the things that they need. And like New York has over 113 positive cases. It is the next state is New Jersey, that has about 30,000 cases.
Right next door.
Which is next door. I mean, this thing could spread like wildfire. And I'm saying wildflowers. and let's look at Louisiana.
Yeah. So
Louisiana's they're experiencing a surge of positive cases.
Yeah. And to have the East Coast connect with what's happening in Louisiana and move further west is what we do not want, to happen.
Like a fire.
That kind of linkage.
We don't want that.
Right.
We don't want that to happen. So to stop everything from the top makes sense, because you stop everything where it is, make the corrections, or do what you have to do so you don't have that spread.
Is this you're a pediatrician, and you've worked in the field, and you're an award-winning doctor. If your patient had symptoms like this, what would your prescription be? Would it be different? Would it be the same than some of the prescriptions they've given us in New York City, nationally?
Well, I mean, right now, there are some experimental drugs that some facilities are using for hospitalized patients, but I work in outpatient. So if I had a patient, and I am a pediatrician, and one of the things that, since we last spoke, we talked about, how children are affected and how, they usually present with like mild symptoms, but probably serve
I remember them saying that kids won't be affected by it. I remember that,
No, right, but no, they are. Yeah. They can get the virus. We even infants, newborns, we've seen infected with corona somehow or another. They've caught either by mom or through the birthing process. We don't know, but we do know that children can be affected. We also know that young adults, the talk 2.5 weeks ago was like, they're not the ones who are getting sick. It's usually the older individuals or individuals with like comorbidities. But now we're seeing that 20 to almost 44% of the 20 to 29% of hospitalized patients are between the ages of 20 44. So that's a big change that's a big revelation from when we last spoke. But if a child comes in, I really would, my clinic is lucky. We do have testing capabilities. So, depending on their symptoms, if I feel like, okay, this might be COVID, I would test them. Depending on their severity, I would tell them, or, I would confirm maybe with the Department of Health, say, hey, I got this case. What should I do? Do they stay in and quarantine? Are they sick enough? Like if they're saying that they have chest pains and they can't breathe, then I know they're going to have to go to the hospital. So on an outpatient level, I'm more outpatient than I I don't work in a hospital so much, but that's
Gotcha.
that's what I would be doing. But there are some, experimental drugs that some doctors or some hospitals might be using on like really sick patients.
Right.
Mm-hmm.
And Doctor, I just wanted to let our listeners know they're listening to the Danny Tisdale Show on Harlem World Radio. This is the Danny Tisdale Show podcast, and we're talking to Dr. Randi Nelson regarding the COVID-19 virus. And I wanted to get back to you, Dr. Nelson, and I guess I'm going to go there anyway, even though we talked about it. We talked about it in the office a little bit, but I'm just curious. I don't see that there's any way that this is related to climate change. No connection whatsoever, correct?
I don't think so. I mean, from what I've read, from what's been, we know that this virus originated in Wuhan, China. It's part of the whole, it's a norovirus related to SARS and the Mediterranean respiratory disease from a couple of years back. So no, I wouldn't. I mean, there's a lot of conspiracy stuff out there. There's a lot of misinformation. And I would just tell people, just look at legitimate sources of information. I don't know if that's where you guys, if that's where you're, kind of getting to, but there's a lot of misinformation. I personally don't think it's related. It's a virus that spreads. It's a very contagious virus. That's what makes this so unusual. It's so contagious. I mean, one of the reasons why we're wearing masks now, they're recommending that we wear masks when we go out and about, is because now they think can be transmitted just by you talking or breathing.
Right.
Okay. Forget about droplets and it being airborne for 3 hours, just by merely talking and breathing. So
you can affect someone or be infected yourself.
Yes, that's the new information that's come out.
Right.
So that's where the recommendation has come now for us to wear. So it's very new. It's evolving, and we're still trying to find out information. Maybe something will come out and say it's related to that, but right now I don't think that's not the talk.
So does that mean that should we start thinking about the aspect of our eyes? If we can, I think, breathe it in through the nose, through one's mouth, or we can share it through our mouth or I guess possibly our nose. Does that mean covering the eyes too, or no?
No, not for the general public. Like my colleagues who are anesthesiologists, who are intensivists in the ICUs, in the hospitals, yes, we have, or even myself, if I'm in the clinic and I am testing someone and I'm really like in their face, because remember, we're supposed to be standing 6 feet away from each other. But if I'm doing like testing on a patient and I'm putting this swab all the way into the back of their nose, they're going to cough, they may sneeze, and I'm literally just inches away from their face.
Right.
Like for me, I need eye protection and eye covering.
Gotcha.
But general public, no, because if you're adhering to what you're supposed to, I don't think that's necessary. Unless
so
you
let
have
me
very
ask you
close
about
contact.
Right, with someone. And let me speak to what you just spoke to, and quite frankly, what we've been hearing a lot of is that, doctors and nurses and all those in between that, are working in the trenches, there seems to be
adequate.
Again, I know it's 2020 hindsight, but I just want to give you your props for doing the work that you're doing, and
thank you.
It sounds like to me like, yes, I'm old enough to remember Vietnam and those soldiers fighting in Vietnam, and they didn't have the right equipment. And we lost tons of soldiers because they didn't have the right equipment. And here we are again with another war, a health war, and it doesn't sound like we have the right equipment for you guys.
That's a great analogy. One of my colleagues said the same thing. It's like we are in war and we are not adequately. Some places are not adequately protected, and it's shameful. It's really, and it makes me a little angry because right now New York, we need all these doctors, we need all these nurses, we need all these healthcare professionals. They need them. They need us to help care for these patients, but we don't have the equipment to protect ourselves. So I mean, it's a lot to ask someone. I mean, yes, we took an oath to serve and help heal folks, but you're almost asking for us to be martyrs. Some people to be martyrs,
right.
Because we know how contagious it is, and because the virus works almost differently in people. Like earlier I said, okay, the thought was it's just older people and individuals that have comorbidities or pre-existing conditions. But we have seen there's plenty of stories out there of very healthy 30-year-olds, 40-year-olds who are succumbing to the disease. It just acts differently. So you haven't. So
and it's quickly. I mean, it's
it's
like
quickly.
3 days.
They can decompensate very quickly. I mean, from what I understand and from what I've heard from other people, that you can be sick for a couple of weeks, but when you get to that point where you're like decompensate, you could be in a hospital room breathing room air 1 minute, and then less than 24 hours you're being intubated. So being placed on a ventilator.
Question, right? Is that how some people have it for 3 weeks and then they're back on track. They, heal, I guess, if that's not the right word, or they no longer have the virus. And then there's some people who are healthy and they have it for 1 or 2 days and they pass.
Right.
And we don't know what the answer is to that.
Right. We don't know what the answer is now. But in terms of our healthcare workers, we have to get them because, again, if all of us, I don't mean to be like overly dramatic, but it's possible.
Right.
If a great deal of us succumb to it or maimed by it, because even if you survive, you can still suffer long-term consequences.
Right.
This is a virus that affects your lungs. Who's going to treat the public? So so that's trust me, I'm in a lot of doc groups, and it's the number one concern, especially here in New York City, because they need the help, but people are afraid. People are very afraid. You do not want to go into this unprotected. So I just hope our government officials really step up. Like I said, I'm happy with what Stephen Marbury's done, arranged 10 million masks to come to New York. Right. I just hope, my colleagues get that information, because you hear about all these millions of equipment, but then you still hear that, I don't have what I need. Well,
I'm sorry. I'm looking at the clock and, seeing that we have.
Goes by fast.
I know we've got 5 minutes left, and there's more and more questions that I have, and I guess I'm just thinking of the, of in some ways from a business perspective of how we kind of got here, and that is that when, is that we could, as a business, you can make more money by having products made in other places outside of the United States. And so, that's how we kind of, I think, got to this place where we have China making our mask, and now we're in need, and we have trouble getting them because we no longer manufacture them here.
Well,
that's a simple explanation. Really... So,
yeah, I mean, there are facilities here who can make it. I just think right now the need. I don't know if this for sure, but if the need is so great, how quickly can we churn these things out? It's just to me it seems making a mask, making the appropriate mask or gown seems a lot easier than say making a ventilator. So I can't.
Thank you.
So I don't understand why there's such a. It's just bottleneck. It seems like a lot of politics are involved.
Thank you so much.
It's just not right.
Yeah, I mean
lives are at stake.
That's exactly where I was going with my next question, because we've got 2 minutes left. Is that it seems like maybe if we talked about the materials and the string that's made, Americans with a fireside chat could easily learn how to make a mask.
But you want
I've
medical,
got some glue,
you want surgical
I've got
grade,
a stapler. Yeah. Am I oversimplifying it, or?
It might be, to a certain degree. Because, there are individuals.
Okay.
I got a beautiful mask that someone made me, but I'm talking about the N95s that are highly specific. I mean, not difficult to make, but they're highly specific. The average American isn't going to sew that together in their, So the people who can make it should be making it, and I just don't understand why we just can't get what we need. I mean, I know why, but
right.
I know why,
especially in a quicker, more immediate way.
Yeah, but we need it. We need it, and I'm just afraid because we still haven't reached the apex. We're still at least maybe 2 weeks away, so it's quite frightening to see how this is going to turn in the next couple of weeks. And and my advice for folks in other areas is watch what's happening in New York and just make sure it doesn't happen in your hometown and your city, and look at what's gone right and look at what's gone wrong, and just do the best, because you don't want this in other areas, which we, like you said, we're starting to see. Louisiana is having Chicago, Detroit, so that's what we are.
So Doctor, we're at a minute now. Is there anything? Trying to find the right words to say here. Is there anything that we can look at to say, okay, when we hit this mark, that's a positive thing, and we can start looking towards more positive things happening? Will there be that moment? Let's say in 2 weeks, the numbers start dropping, or I think I'm doing a terrible job of explaining what I mean, but hopefully you get it.
I think that's I understand. I think once we start seeing raw data that hospitalizations have decreased, ICU admissions have decreased, new cases have decreased, death, of course, the rate of death have decreased. Those are positive. That's what we're looking. When I look at these news conferences, that's what I'm looking for.
Doctor, let me stop you, because we've got 15 seconds left.
Okay.
I want to thank you for being on the show. Is there any URL that you could leave us right quick?
Just look at the CDC and just go to trusted medical sources and news outlets. Thank
you, Doctor, and I'll reach back to you a little later. Thank you very much.
Okay.
Thank you.
Bye-bye.
And be safe. Bye-bye.
You too. Bye.